to get on the lateral border and free them this way. In fact, it's rare that you're going to work on the wrong side. The more freedom you can get in both directions, the better these muscles are going to work. The quadriceps muscles. Notice the different attachment points and angles of pull of the quadriceps muscles. It is important to create balance between these muscles so that torsion on the knee can be eliminated. Just to give one more example, like what we did to the calves, I'm going to show this with Dina's quadriceps. Runners, athletes always like this. I can grab her IT band and make this part of this, or I can really isolate the quadriceps group, whichever you feel like working with. But you just get a big broad hold here, you lift the muscle off the bone, and then move it so that it's able to slide across that bone. And I can feel those fibers right down next to the bone coming to their end range. And then when I get that, then I sort of hold, maybe do some rotation, and get this moving. Can also do some rolling here and try to keep her femur from rolling so that I'm actually rolling the muscle off the bone. Sternocleidomastoid muscles. Notice the two attachments at both the sternum and the clavicle and the broad attachment to the mastoid process. Learning how to separate the sternocleidomastoid from the deeper scalene muscles is also an important skill to have. The sternocleidomastoid muscle is a very important muscle. Tightness in this muscle can have trigger point referral patterns that cause headaches, and a lot of people that breathe with their neck muscles rather than building the pressure up from down below by breathing abdominally, the sternocleidomastoid muscle can be very, very tight along with the scalenes. So this is another example of trying to show how you can free a muscle from entrapment. This sternocleidomastoid should be able to slide from that tissue down below. And a lot of times you'll feel with people that it's just glued down. This isn't something that you free up in one session, but with multiple repeat sessions, you can get a lot of freedom with this sternocleidomastoid. So what you want to do with this, if it's put on too much of a stretch, you're not going to be able to grab it. You want it to be in a shortened position. So you want to rotate your client's head away from the SCM that you're working on. This will shorten and soften the muscle and also make it more accessible for you to grab. And with nice soft fingers, adjust the neck rotation so that you can gently grasp that SCM and lift it free from any deep tissue that it seems to be adhered to. This might take a minute or two when you're actually working, and when we're working on the neck, you'll get a better shot of this, but I just want to give this as an example of freeing muscles from entrapment. Once you have it out there and you have a pretty good grip on it, you then can start moving it in a lengthwise manner, trying to free it up. Just visualize these little cross fibers down below that have had that glued, and you can start going back and forth with that. This may look rather intense, but it usually feels very, very good to the person you're working on. Now I'm rotating her head a little bit to get a little bit more stretch there. Tensor fascia lata and iliotibial band. Notice that in addition to the tensor fascia lata, the gluteus maximus can put strain upon the iliotibial band. The next specific type of stroke I'd like to talk about is a stroke that separates muscle compartments. We, in some ways, could say that this is similar to the last stroke we did, which is separating muscle compartments from deeper layers where they've been glued. But very often, muscles that are supposed to be running alongside each other will then get glued to each other so that there isn't a real sharp demarcation. One of the areas that this is most evident in is with the IT band or the fascia lata, and it can get glued to both the quadriceps group here or to the hamstrings group here. And what you'll often notice when you feel with people is that it can slide one way much easier than another. Dina's slides much more easy toward the hamstring than it does away from the hamstring. So she's a little bit bound right along the hamstring here. And this might cause a lot of torsion and tension on her knee. So all I'm going to do is try to differentiate these muscles from each other so that they can slide in different directions. Again, we will go in much more detail in the tape talking about how to work on the knee for specific techniques here. So this is one that I often use just my fingers. And what I'll do is I'll just get on the top border of the IT band here, and here's the quadriceps, here's vastus lateralis here, and I'll just slide right down there. Anytime I feel some adhesions, some tension there, I'm just going to sink in, possibly roll this quadriceps away, see if maybe there's too much tension. If I roll it toward it so that I can get a little bit better grip on here and soften this and work my way down. Very, very slowly. This is going to be work that requires very, very patient work because it's going to be very tender. Since Dina is more bound toward her hamstrings, I'll probably have better luck by grabbing this IT band, pulling it away, and then trying to find the hamstring area that is bound to it. So I'm rotating her leg internally, finding areas here with the hamstring, and there's some fibrous area right here. And right in there. And I'm just going to wait for that tissue to melt. Notice how slowly I'm working. I could use my knuckles here because I'm pretty used to doing this, but you're not going to get quite as sharp a hold there. So it's up to you how you feel with the strength of your fingers to do that. If your fingers aren't quite strong enough, then use your knuckles. You'll also find it's much easier to have your hand resting on the table when you do this rather than trying to lift it up. The gastrocnemius muscles. Notice that these are actually two different muscles with different attachment points. Depending upon the strain placed on the lower leg, one muscle may be considerably tighter than the other and create torsional strain upon the Achilles tendon. Hamstring muscles. Many beginning massage classes talk about relaxing the hamstrings as if they were just one muscle. Notice the wide variation in angle and how tightness on either the lateral or medial hamstrings can place strain upon the knee. On the gastroc area, you could even differentiate the lateral head from the medial head. There's a nice septum that runs up the back of the leg here with the gastroc basically being a two-headed muscle. So sometimes if one side's much tighter than the other and it's pulling in an inordinate angle or something like that with too much stress, all you need to do is just separate these muscles. And you can almost see with Dina's hamstrings here, we've talked about how they're sort of bound to the IT band here. You can almost see her lateral hamstring being pulled over toward the IT band. So not only is it pulling the IT band back, but this hamstring is pulled too far laterally so that it's not pulling straight on the leg here. So all I need to do on this one, I think I'm going to shorten the hamstrings a little bit so I can sink in. So I just lift the leg a little bit, almost like we did with the anchor and stretch, but I'm not going to be actually moving down here too much. I can a little bit, but I'm just going to work my way up all the way along this lateral hamstring here. Anytime I feel any fibrousness, I may want to shorten it a little bit more to sink in here. let's discuss the importance of body positioning in your strategies for working on your clients. I think in early massage training, we often look at a massage as a chess game with two moves. The client is either beginning on their stomach or beginning on their back, and you have one move to turn them over. As we get into problem solving, it becomes very important to have an understanding of anatomy and kinesiology so that you can place joints in such a position to make a stretch on the muscle you're working on. Let's look at the biceps and the elbow as an example of this. If you have a client coming in that's been lifting weights for 15 years and this is about as straight as his arm can get, then you can do all the work you can in a neutral position for him, which would be about like this, of softening the muscle, of working with adhesions, but in all probability, when he stands up and gets off the table, his arm is still going to be bent at about this angle because you've not given any signal to this muscle to lengthen. So the importance of understanding how to move bodies can help your work immeasurably in the results you'll have, because the main issue that we have talked about in this series has been the importance of stretching muscles rather than just squeezing muscles. So do take the time to cultivate these skills of learning how to move bodies and have an understanding of kinesiology and anatomy so that you can work with the neurological component of muscles rather than just squeezing and softening muscles. You can give very, very important cues to your clients to have longer, more supple, and more freer movement if you start stretching their muscles when you're working on them. The rhomboid muscles. The rotation of the scapula will dictate whether you are stretching the lower or the upper fibers of the rhomboids. A clockwise rotation can stretch the upper fibers, while a counterclockwise rotation can stretch the lower fibers. We've talked earlier about how the rhomboids attach to the spine and then come along the medial border of the scapula here. If we look at the upper fibers versus the lower fibers, we notice that when the scapula is in a neutral position, the lower fibers are longer here. If I want to work on the upper fibers, I want to bring this scapula as far rotated this direction as possible so that these muscles can lengthen and redefine themselves. If I call my client into doing some active work along with this, all I need to do is facilitate that lengthening and call for her to reach down with her arm, and that's going to rotate this scapula. So somebody that's very, very tight in the upper scapula, you would continue to work on them this way. They may have a lot of length here, and you don't need to redefine that. However, somebody that's got their scapula pulled this way with very short fibers, you're going to want to stretch those. And working in this position is not going to do that because the scapula is rotated in this direction. So all you would need to do would be to take the arm up, and that rotates the scapula this way so that you can then work on those lower fibers and lengthen those. If you wanted to reset those neurological factors that are determining muscle length, you might even have your client reach up above their head while you're working. It may seem strange to be asking for movement from your client, but as you're moving into deep tissue work, people expect this, and you'll find that its increased effectiveness will more than make up for the upset that you may be thinking you're giving this person when you think they're totally relaxed. Along the same lines, a lot of people come in with their shoulders up toward their ears. So all you need to do is be sure that you've got this shoulder down as far as you can. If you want to call for active movements, that's great, but you just be sure that you put a stretch on this muscle. You don't have to call for active movement, but that is the way to make it the most effective. The main thing is to consider, how do you want this body placed so that that muscle is on a maximum stretch? So as we were talking about earlier, the issue of whether you have a one or a two joint muscle and how it crosses a joint is a real important factor to consider when you're planning your strategy. The gastroc-soleus combination here is a perfect way to demonstrate this. As we said, I really want to try to get a stretch to most muscles. Most muscles problems are caused by shortness rather than just tightness. So most classes, when they demonstrate working on the back of the calf and on the soleus and the gastrocnemius, indicate that you want to have a bolster here so that the foot is not compressed against the table. The problem with this is that the bend in the knee places a gastroc in a shortened position, so it is difficult to stretch. The soleus isn't affected by knee flexion, but you can see that it is difficult to stretch it also because of the limitations of ankle plantar flexion as it rests on the table. One of the ways that I will try to get around this problem to put the gastroc on a stretch is that we can move the leg right off the table. I can then move in with my knee and put a stretch on the gastroc. So now I can use any stroke I want. I can do a raking stroke with my forearm. I can do more precise work with knuckles. Again, you might work in very different speeds from what I'm doing here. I just want to show you some of the tools that we would be using. The fist is another fine way to work on the gastroc here. Of course, I can work on the soleus, but with the gastroc in a stretch here, it's going to be hard, and it's going to be hard for me to work on the soleus. So for me to work on the soleus and put it in a stretch, all I need to do is bend the knee, which softens the gastroc, and then I can stretch the soleus by putting some weight and flexing the ankle, and then work on the soleus any way I want to. One of the other things you consider when you first begin your massage and you're evaluating where tension is, if you notice that the calves are very tight, you don't have to do all the work when the client is face down. What you can do is sort of mark that in your memory that when you turn the client over into supine position, it's another great way to get a stretch behind the legs. So Dina, if I can have you turn over here, I'll demonstrate how you would work there. So now, as Dina's lying in the supine position, her knee is fully extended. I can vary the amount of stretch to the posterior compartment here by how I flex her foot, and I can use my shoulder so that I have both hands free. I can now work on the gastroc clear up near the knee. I could even cross the knee joint and work on the lower hamstrings this way. And I can work all the way down the leg this way. Basically, my hands are just milking tissue, grabbing tissue rather than sliding over it, and stretching it, leaving her with a message that when she walks off this table, her gastrocs are actually going to be longer. The hamstrings present another example of putting a muscle on a stretch and the benefit of body positioning. 95% of the work that I see done on hamstrings, the client is in the prone position, and so the best stretch that you're going to get is into neutral position. And basically, with the hamstrings, most of the problems of tightness with muscle pulls come when they're in a stretched and extended position. So to lengthen the hamstrings, you may do some warm-up work with the client in prone position, but I really like to do a lot of work with Dina lying in the supine position where I can put different parts of the hamstring into a stretch. So the first thing I would do would be I would bend the knee, take care of my back, and I'd put her foot right on my shoulder so that I can focus on the lower hamstrings. What I can do with the knee flexed here, her hamstrings are in a shortened position. I then anchor them in this shortened position wherever I feel tension. I can use my thumbs on this because it's much easier to just anchor here. It doesn't require a whole lot of pressure or force on the thumbs. And then all I need to do is just lean back, and I can generate almost all of my force right where my thumbs are to free up tissue that's tight here. This is very effective work. A lot of runners and bicyclists just love this work. Can go all the way to extension now. Her hamstrings put on a bit of a stretch. already, so we're getting a very good stretch through the whole length of the hamstring, and I can work anywhere along here, wherever I feel tension. I could take a nice broad stroke as well. Up near the origin in the ischial tuberosity, the hamstring is a totally separate issue here. If I can anchor here, even though her knee is flexed and the lower hamstring is in a shortened position, I am stretching the upper hamstring now. And all I need to do is just force her knee into hip flexion here and anchor or move down over this hamstring, and I can put a great stretch on it here. You can also work on hip rotation. If you feel that her hip wants to move out rather than moving in, you just counter that and work in a little bit different angle. You can work very specifically with your knuckle at the tendinous insertion. Notice that on this, rather than staying close and muscling this, I'm going to get up, step back, and lean in, and then move this way. If you want to work with rotational issues of the hamstrings and the IT band, then all you can have Dina do is just grab her knee. She can provide the force, and I can work with rotation with this hand as I come down and again generate my force at the upper hamstring. This is also a nice place to do the fist. Notice that my wrist is in a neutral position, my hand is relaxed. The forearm holds a lot of tension for a lot of people. I think it's one of the most underworked parts of massage. But again, we want to stretch this rather than just squeezing tissue in a neutral position. So what I do is I take the arm over to the edge of the table,